Welcome to the State of Black Oakland 2020 Political Scorecard Panel Discussion. This panel discussion is in celebration of Juneteenth. As we celebrate Juneteenth across the United States, let us also think about the quality of Black life in the city of Oakland, California. The agenda is as follows: introduction, a brief scorecard review, discussion, and conclusion. I am pleased to welcome our panelists and introduce all of them, starting with Pamela Price. Attorney Pamela Price was raised in Cincinnati, Ohio. She joined the civil rights movement when she was just 13 years old. She is a survivor of the Ohio juvenile justice and foster care systems. She graduated from Yale University with a BA in political science in 1978. While at Yale, she spent her junior year abroad in Dar es Salaam, Tanzania, East Africa. After Yale, Price attended Berkeley School of Law, Boalt Hall, where she received her JD and a master's degree in jurisprudence and social policy in 1982. She started her career as a criminal defender in Bayview Hunters Point in San Francisco. In June 1991, she founded her own firm in Oakland. Her firm successfully represented victims of sex and race discrimination in difficult cases and trials. Dr. Barbara Bowman is an elementary educator for over 25 years, both in public and private schools. She's a community advocate, a trauma-informed care and youth professional, an advocate for literacy of all elementary age children reading at their current grade level and higher. She's an Alameda County CASA board member and an Alzheimer's Association volunteer as a community educator. Dr. Victor Asamota is Associate Professor of Biochemistry, Chemistry, Endocrinology, Physiology, and Human Anatomy. He's also the Executive Director of Urban Scientists, a nonprofit organization dedicated to educating all people about science. Economist Maisha House is the owner and principal economist of Trinity Economic Development Group, developer of the State of Black Oakland Political Scorecard 2020, community college educator for over 15 years, and community advocate. This is the State of Black Oakland Political Scorecard 2020. The idea behind this scorecard is to give citizens the opportunity to understand specific components impacting the quality of life in the city of Oakland. The scorecard is divided into 10 categories, and each category is explained using Oakland Black impact in terms of percentage, estimated number, comments, and solutions. If you'd like to dig deeper into the scorecard, you may review the video entitled State of Black Oakland Political Scorecard 2020. For the purposes of our panel discussion, we have condensed each category into 4 components: Black economics, Black education, Black politics, Black health. Let's begin. Economics is the science of choice. In this discipline, one studies how resources are paired to wants. In most cases, resources are limited and wants are unlimited. So the concept looks at how a society, a city, a nation is able to make choices given limited resources, and unlimited wants. In the case of Black economics, we're looking at how to employ scarce resources to improve the quality of life in the Black community. In the case of City of Oakland, the Black population has decreased by nearly 50% since 2010. That's a dramatic decrease. And what's driving this mass exodus out of the City of Oakland is Black economic terrorism. Roughly 10% of the Black community is unemployed in the City of Oakland, and the Black labor force participation rate is 35%. These numbers are very concerning. 10% is the highest in the city, and the labor force participation rate pretty much says that 35% of the Black population is not included in the labor force. And there are a number of reasons for this. One is the concept of disgruntled workers, where workers have spent hours and hours, days and months trying to find jobs, and they've been frustrated to the point where they drop out of the labor market. The other are specific discriminatory factors in terms of previous incarceration, ageism, workers who are above 45 years old, and underemployment. These ideas, coupled with the fact that we have crime in the City of Oakland that's not being addressed, education issues that aren't being addressed, and health issues that aren't being addressed, arrest rates that are astronomical, are driving the mass exodus of Blacks out of Oakland. Roughly 20% of Blacks in the Oakland have an undergraduate or higher degree, while less than 5% make $100,000 per year. This is the complete driver around quality of jobs. Many Blacks in the City of Oakland are underemployed, meaning that they have a job, but it doesn't relate to their experience or background. So therefore, they don't make the income commensurate to the degree. All of this information is alarming. A diaspora district can be considered to address some of these concepts. A diaspora district would be a location in the City of Oakland that is expressly concerned and related to the quality of life in the City of Oakland. This district would have workforce development programs, community service programs, art, and music in order to have a holistic view of improving these statistics related to the quality of life.
So happy to be a part of the panel this morning, and of course, being in elementary education for 16 plus years or more, and then just overall in education for 25 plus years. And of course, it's disheartening when I look at the State of Black Oakland political scorecard and find here that our Black high school dropout rate is the highest in the city, and it's at 20%. But of course, my response to that would be that it all started at the elementary level. And it's just unfortunate that in so many ways, our students have not been able to flourish. And of course, March 16th is something that will be imprinted upon our minds for years to come, because that was when schools were shut down, report cards were due, and then of course there's that push to get our students. We only had about 2.5 months to get them to the end of the school year. So needless to say, we are in a situation where we're having to rethink how we're going to move forward in this, I guess we could define it as the new normal. And so in relationship and response to the political scorecard, my emphasis and my thoughts would be, how are we going to move forward in terms of preparing the curriculum to meet our new challenges? And so one thing that really, and there's a lot here regarding the political scorecard, a lot of things to talk about, which each of them brings its own challenges. And the one that I wanted to make some comments on would be the mandatory Black history curriculum. I think now more than any other time before, that would be a good starting place to definitely integrate, have a strong Black history curriculum for grades K through 12 from now until, because my professional opinion is that if we were to have a vigorous Black history curriculum, because when you talk about our history, then you're talking about all history, because we were there, unfortunately, the backdrop being our ancestors' forefathers being enslaved. And so I believe that for every student, when you know your identity, then I believe you can best go forth in life because you know who you are and you're very informed about where you came from. And so very briefly, I wanted to really say that I believe our current superintendent, Dr. Johnson Trammell, put out some guidelines and some directives or direction which she feels that we're going. And I hope that it will satisfy a lot of what you're presenting here regarding the political scorecard around digital tutoring and so forth. She's looking at blended instructional model, different approaches by age, supporting wellness, and there could be intermittent closures. And so I'm hoping that whoever's at the table, I know they have 7 groups that they have organized and is touching on pretty much a lot of the areas that you have addressed on the scorecard: instruction, technology, operations, facilities, finances, wellness, and community. And so it's an inclusive model, which now they have brought everyone to the table from all aspects of the community, and I'm really happy about that. So in my brief closing remarks, there's a major question that I think would be helpful, for Oakland Unified in particularly, and that is the question of why does our school environments lack the conditions for students to flourish? That would be the question. And I think that brings everyone to the table. Everyone, whatever your position is, that of leadership, that of teacher, that of parent, that of community, the question for me as we go forth is, why does our schools environment lack the conditions for students to flourish?
The issues that I'm honored to address, and I want to say happy Juneteenth to everybody, and I appreciate that we're doing this in honor of Juneteenth, which is really certainly an acknowledgement that we as Black people have managed to survive in this country despite overwhelming odds against us from the time that we were brought here against our will, and that we stand here today as the descendants of slaves and on the shoulders of those who believe that despite the odds, despite the troubles, despite the oppression, that there would be a better day for all of us. And so that's the legacy that we have and that we have to continue to push forward. This conversation thus far is represented, and certainly the state, the political scorecard represents that we are in crisis in Oakland, which is no different from other major cities and places throughout the country, and certainly in the wake of the murders that have come to public sort of publicity, media outrage, because we all know from that the video of George Floyd is not the first video of a Black man being assaulted and killed that we have seen. And it is certainly not the first or the last that we have experienced. We are all survivors of trauma of the historical oppression of Black people in this country. And so the issues that we're addressing today are so important now as they have been, but hopefully in the fervor of Black Lives Matter and the societal view about that this will get the attention that it deserves, and it will lead to lasting solutions. I have said repeatedly, and I appreciate you, Maisha, that there is no better place to start addressing the inequities, the economic and systematic racism that Black people face in this country than in the criminal justice system. That is where it is most reflected. We represent the miner's canary in America, and the things that happen to us in the criminal justice system and through the use of policing represent the toxic and unhealthy nature of how society treats, how we treat our residents in this country, unfortunately. So when we talk about arrest rates in Oakland, we're talking about a systematic racist institution that has remained consistent. I tell people that when I came here in 1978, 2 blocks, less than a year after I got here, 2 blocks from my house, the police killed 14-year-old Melvin Black because they thought he had a BB gun was a real gun, and they thought a 14-year-old was a grown man. Fast forward to 2018, when we look at the statistics in terms of arrests, not only of adults, but of juveniles. Right now, today, in Alameda County, 86% of all juvenile felony arrests are Black or brown children. And that's over 60% of those are Black children. And we know most of those are concentrated in the city of Oakland. Another 20, almost 21% are Latino children. And so we know that those are primarily constituted in Oakland. So there is a huge racial disparity that has persisted in Oakland throughout the history of policing in Oakland. And we are getting nowhere fast in terms of our ability to address that. And that is why it is so significant now as we hear widespread support for defund the police, that we understand and we push for the reallocation of resources. But more than that, we have to be aggressive. Our solutions have to recognize that we have to move beyond sort of placebos and ways of looking at how we can do more community policing or training or implicit bias. All of that has been tried and failed in Oakland. We have been under a consent decree for 17 years. We have been under federal court jurisdiction that has mandated most of that. The Stanford study was done in 2014, and in terms of how Black people in Oakland are treated by police in Oakland. And that was 11 years after the consent decree was put into practice. And so as we face this new, hopefully this new era of how we think about public safety, we have to recognize we need to do it in a very aggressive, intentional way of reducing the impact of policing on the Black community, the impact of incarceration, and incarceration not just today, but the practices that have resulted in incarceration over the last few decades, from the time we had the war on drugs till now. We're looking at people with felony convictions that are unfortunately crippled. And when we talk about doing job training and economic programs, folks are excluded from that and hindered in their ability to participate in the job market by reason of the fact that they have already been branded and stigmatized by the criminal justice system. And in many times, it's solely, predominantly because of the color of their skin. Right. And so we've got to get back to the root of the problem when we're talking about policing. We got to talk about public safety in different ways. We got to talk about within the Oakland Police Department, the Oakland Police Disparity Report, which just was released a couple of months ago, found that Black officers are 37 times more likely to be disciplined than white officers.
Yes.
That's, almost 20 years after OPD has been under a consent decree. And the Black Police Officers Association sounded the alarm last year by saying we are not being heard by the city administration. We have a police chief who is not responsive to our concerns. And I can tell you, while I was in law school, I helped the Oakland Black Police Officers Association that was trying to break down barriers of discrimination and racism then. And unfortunately, what we find is that Black officers who challenge the status quo, who sound the alarm, are usually victims of retaliation. And we've seen that over again.
Exactly.
So that is something that, as we deal with solutions for how the department addresses its discriminatory practice, again, recognize we're dealing with an institution that has racism inbred into it, and that the solution has to be aggressively to address that, not simply as an add-on and how we might fix these things going forward. I want to take some time, and I'm not monitoring my time. I'm not very good at that, so let me know. Housing and the unhoused population in Oakland. Again, a lot of that, all of it, we know the factors that drive it. It's economic injustices. We don't have credit scores. We don't have good credit scores. The wealth gap, the racial wealth gap has a real impact when you're talking about housing. The historical practices of redlining that essentially confined Black people in Oakland and Alameda County to particular sections of the city, those patterns still exist and have not been broken. And because of those patterns, then when you have the economic shift, we have a concentration of wealth, which you've addressed, that results, the unhoused problem, the explosion of homelessness in Oakland, which has been the predominant feature is Black people who are from Oakland, who are from Alameda County, who have not been able to afford or find housing in this market as a result of racism. And the solution has to recognize that and has to be focused on addressing the racial impacts of redlining, the racial impacts of the way that finances or funding has not been provided to us economically to allow us to be able to purchase homes, the impact of the crack epidemic, where you saw generational poverty being perpetuated, and people who did own homes, particularly throughout in the Black community, people owned homes, and those homes were lost through the generations of folks. The next generation was not able financially to afford the cost of those housing. And then the gentrification, which has been accompanied and accelerated the displacement of Oaklanders.
It's Dr. Victor Smolden, and I'm going to talk about Black health in Oakland and some of the environmental health issues related to living in Oakland as well. And what we do see, based on statistics, that the infant mortality rate of Black children tend to be higher than that of other racial ethnic groups. And the same is true with mortality rate that is also associated with the maternal rate. Black women mortality rate is also about 3 times when compared to other ethnic group in the country, in the United States as a whole. But what we want to also talk about here is that looking at data from CDC and from other medical organizations, one of the driving force for this mortality rate has to do with lack of advocacy for the mothers of childbearing age in Oakland, and those poor advocacy measures leads to this poor healthcare outcome. And what we also want to talk about here is that, or what I also want to draw on is that there are studies that have also shown that as education level increases, the mortality rate also decreases as well. And so what this brings us to is that we should have advocacy program that will educate women of childbearing age on what to do once they become, once they get into that childbearing age, things like providing them with things like folic acid, providing them with so many of the health indicators that will help them carry pregnancy successfully. So those advocacy measures are some of the things that we can try or we can do to be able to limit and stop this increase in mortality rate of Black women. And also, we should also take a look at during the gestation period itself. In the first trimester, immediately the woman knows she's pregnant, she should go to see the OB-GYN or the obstetricians in her neighborhood. And that also brings us to establishing neighborhood community hospitals whereby women are free to go into and be able to speak and be able to express themselves regardless of income and state. And so these are going to be important. We need to go to the hospital quickly during the first trimester, do all the appropriate tests that is required during that fourth trimester period, and also follow up continuously in the second trimester, and also do all the appropriate follow-up tests in the second trimester. And it goes into the third trimester as well. Women still need to go to the hospital during the third trimester for further tests, up to even the 36th, 37th weeks of gestation. And also during the gestation period, there should be advocate group that help assist women through the birthing process and period also. And classes are also available. And some of these classes can be sponsored such that women should know exactly what to expect during that period of gestation also. And also after birth or the after birth period or the postnatal period, we should also follow women through to make sure that the infants have all the necessary immunizations, all the necessary care, all the nutrients available, and also have a safe environment to grow. And so when we do all these things, I believe it will reduce the mortality rate, the infant mortality rate in the Black community, and it will also reduce the maternal mortality rate as well in the Black community of the United States. And another area that I want to talk about is the environment. What we've seen in Oakland lately is pollution. It could be in the form of noise, in the form of air pollution. And we can also see that children that lives in Oakland also have higher rate of asthma attack due to the air pollution, the trucking services, and all the waste effluent that is being released into the atmosphere of this community. And another thing that we also want to address is the waste and dumping that we see around the city. And this waste and dumping that we see around the city reduce the quality of life. It causes an environmental stress on the residents of Oakland. And this environmental stress can trigger hypertension, and hypertension can trigger stroke, and which could shorten the life expectancy of the residents of Oakland as well also. And again, this is also tied to the maternal mortality, which would also can be implicated as part of the comorbidities that we see, such as hypertension, diabetes, obesity, and so on and so forth, that could reduce the quality of individual's life. So City of Oakland need to do a lot of cleaning and need to create a peaceful atmosphere where the residents can be stress-free. And also doing this will improve the entire health outcome of the residents of Oakland. Again, I'm going to stop there based on the scorecard. You can also tie this to so many of the metrics that has been given in the other areas of the Oakland scorecard. And again, I want to say thank you for having me and for making me be part of this panel.
In closing, the Black community in Oakland is under attack. From gentrification to maternal mortality to unemployment to public safety, arrest rates, lack of jobs, underemployment, mass incarceration, environmental degradation, education, and depopulation, we need the city of Oakland to act. We need action now. We need direct investment in entrepreneurship, education, job development, and housing. We need a space to have cultural celebration of our sports, our entertainment, our history, music, and art. We need policy and protections against structural racism of all forms. We call on the city of Oakland to create a reparations fund specifically for Black people to address our dire state of affairs. I thank each and every panelist for participating in this discussion. The time is now. We are the change, and change is the future. I hope each and every city politician, county politician, and state politician take heed of the call of the people. The people are speaking. I hope each and every resident and citizen have discussions with each other about this dastardly state of affairs. It is my desire that the quality of Black life improve before the end of 2020. And I believe through direct actions, we can make that happen.